The introduction, the future doesn't belong to the faint-hearted, it belongs to the brave. It's a reminder that courage and determination are keys to navigating life with type 1 diabetes. So today we'll start off, if I can get the PowerPoint up, with juvenile diabetes and podiatry. And please, if you can set up a shared screen.
Okay, yes, you can share your screen.
Right.
Okay, yes, we can see your screen.
These are some. Okay, thank you. So these are some of the agendas that we'll be covering today. We're going to look to inspire, inform, empower, ignite, and then lastly, we'll go through the summary. So in the introduction, the future doesn't belong to the faint-hearted, as I was saying earlier, it belongs to the brave. It's a reminder that courage and determination are keys to navigating life with type 1 diabetes. Now, we will start the discussion with juvenile diabetes and podiatry. What do we know? Type 1 diabetes, often referred to as juvenile diabetes, is a condition in where the body's immune system destroys the insulin-producing cells in the pancreas. This means that the body can't produce insulin, a hormone that's like a key, opening the doors to our cells to let glucose in. Without insulin, glucose builds up in the bloodstream instead of being used for energy. It's important to remember that type 1 diabetes is not preventable, and it's not the fault of the individual who has it. It's like being dealt a particular hand of cards. We don't get to choose. But with careful management, including regular insulin injections or use of an insulin pump, people with type 1 diabetes can lead full, healthy, productive lives. So we'll move on to now the importance of blood sugar control. In terms of managing your blood sugar, it's a matter of preventing complications that can lead to heart disease, kidney damage, and nerve damage. It's about ensuring that every Nigerian has the chance to live a healthy, prosperous life. Secondly, when you're able to control your blood sugar, it plays a key role in weight management. When blood sugar levels are stable, it's easier to maintain a healthy weight and prevent excessive weight gain. So you see, controlling blood sugar is not just about personal health, it's about ensuring the strength and vitality of our great nation. So we're looking at a healthy Nigeria is going to lead to a strong Nigeria. So you may be asking yourself at this time, how can I control my blood sugar levels? As the lecture yesterday explained on nutrition, we're talking about portion size, foods that we eat, and taking the right dosage of your insulin. It's important to also balance what you eat and what you do. Extra calories that you see, eat, or drink must be worked off to maintain your weight. It's like a seesaw. You've got to keep it level to have the most fun. When you balance your nutrition and physical activity to achieve physical wellness, you'll look and feel better, have better overall health, and live longer. Remember, it's not about being perfect. It's about making better choices more often. So lace up those sneakers, fill up the water bottle, and let's get moving. Podiatry. I'm sure a lot of you out there are wondering, what is podiatry? You've never heard of podiatry before because unfortunately, podiatry is not yet in Nigeria. But podiatry basically is the medical specialty that deals with the lower limbs only. So we are trained to prevent loss of the limbs. And because we as podiatrists or podiatrist healthcare caregivers, we are married to people living with diabetes because we help people living with diabetes to keep their limbs and not to lose it. Many people are working very hard to bring this new and exciting field of medicine to Nigeria. Organizations like ours, Podiatry Foundation of Nigeria, is working with many partners here at home and the US to make it a reality. At home here, we have the Podiatry Foundation of Nigeria that's also working along with Diabetes Association of Nigeria, MDCM, which is the Medical and Dental Council of Nigeria. We have other tertiary institutions. And in the US, we're working with podiatry schools, many of the podiatry schools, Nigerian Podiatry Medical Association, also known as NPMA, and the Podiatry Foundation of Nigeria. In addition to, we have a lot of support from the IDF, which is the International Diabetes Federation, and WHO, World Health Organization. So let's talk about this journey of ours. You see, just like our great nation, every journey begins with a solid foundation. And when it comes to our personal health, that foundation is often our feet. They carry us through life, just as our shared values carry us as a nation. So we'll start off talking today about foot care. Many people with diabetes have peripheral artery disease. We also call it PAD. Now, which reduces blood flow to the feet. Also, many people with diabetes have neuropathy. You sometimes get these like pins and needles, this feeling of cramping. So all of this causes you not to feel your feet. Together, these problems make it very easy to get ulcers and infections that may lead to amputations. So we'll discuss the importance of regular foot examination. Just as we must regularly check the state of our nation, we must also check the state of our feet. So when you're checking for your feet now, the first thing that you should do is that you should look for any changes in color, shape, or sensation. You should try to inspect your feet every day, both morning and evening. Specifically, you can use a mirror to look at the bottom of your feet. If you can't do it by yourself, a family member or caregiver can assist you. So the things to look out for, we're looking for bumps or blisters. Number two, if you notice any hot or cold areas in your feet. Number three, you have to wash your feet daily with warm water, not hot, not cold. Warm is the best, and dry it off carefully. Usually you can try to pat it because the skin is going to be very, very sensitive. Apply moisturizer to the feet. Avoid putting it in between your toes. No Vaseline, no lotion. Do not put it in between your toes because it can easily get macerated. Avoid being barefoot, especially if you have a loss of sensation, which we talked about, which is the neuropathy in the foot. If you can wear socks, you should try to wear socks all the time to make sure there's a seamless sock, a sock that does not have a seam across, so it doesn't cause bruise or injury. If you see any break in the skin or any abnormal condition that you are not comfortable, notify your physician. Please do not ignore. So getting back to what I was saying, foot care, many people with diabetes have that PAD. We'll also talk about the proper footwear that you can use. Preferably, we're looking for what? Wide toe box shoes. We're looking for sneakers that have enough padding Just as we wouldn't send our troops into battle without proper gear, we shouldn't venture into our daily lives without the right shoes. They should be comfortable, supportive, and well-fitted. No high heels, no narrow toe point shoes. That's not conducive for people with diabetes. And remember, my friends, there's no shame in asking for help. If you're unsure about what kind of shoes to wear, consult a professional. Lastly, we'll touch on the importance of a healthy lifestyle. Regular exercise, a balanced diet, and adequate rest are all crucial for maintaining healthy feet. So we're talking now, we'll move on to empowerment. Managing juvenile diabetes, also known as type 1 diabetes, is a challenge that requires a comprehensive approach. It's like building a wall brick by brick. Each brick represents a different aspect of management, and together they form a strong defense against this disease. So you have to pay attention to all the latest things that are coming out in terms of diabetic care. You can consult your physician, you can consult the internet, you can go to the latest technologies and advances in terms of diabetes care. You have all the tools that you need to be able to do self-empowerment. Education. Firstly, education is paramount. We need to ensure that children, their parents, and caregivers understand the disease, its symptoms, and how to manage it. It's like giving the blueprint to build a wall. They need to know how to monitor blood sugar levels, which you should be checking every day, administer insulin, and recognize the signs of both high and low blood sugar. We'll move on to a healthy lifestyle. Secondly, we need to promote a healthy lifestyle. Regular physical activity and a balanced diet can go a long way in managing blood sugar levels. It's like the mortar that holds that bricks together. Without the mortar, the wall would crumble. We touched also on regular medical checkups. Thirdly, regular medical checkups are crucial. Regular monitoring can help detect any complications early and adjust treatment plans as necessary. We talked about looking, just don't ignore it. Like if you see a bruise on your foot and it's like, oh, it will go away. You have to remember that diabetics, they need extra care than what someone that is not living with diabetes would need. So they have to be more vigilant in terms of outbreaks that they see. Don't be ashamed to ask anyone any question. Now, emotional support. Fourthly, we need to provide emotional and psychological support. Living with a chronic disease can be challenging, and it's important to ensure that the children and their families have the support they need. So we'll talk now about the policies. Lastly, we need to advocate for policies that support children and their families. This could include ensuring access to affordable healthcare, promoting research into new treatments, and protecting the rights of children with diabetes. It's like ensuring that the builders have all the tools and materials they need to build the wall. Education in podiatric care in type 1. As we mentioned earlier before, education, I can't stress it enough, is the key. Children with diabetes and their caregivers need to understand the importance of foot care. We mentioned some of them again. They should be taught to check their feet daily for any cuts, blisters, redness, swelling, or nail problems. Now we'll touch on the nail problems. When you, as a diabetic, are cutting your nails, know that your nails, you need to cut them straight across. Do not bend them at the corners, because the nail then can drive into the skin at the edges and make wounds there. So you want to cut your nail straight across so that they don't dig into the sides of the skin. Podiatry and good hygiene. Secondly, good hygiene is crucial. Washing the feet daily with warm water and mild soap, drying them thoroughly, especially between the toes, and applying a good moisturizer, but not between the toes, can help keep the skin healthy and prevent infections. It's like keeping the car clean and well oiled. Thirdly, wearing the right footwear is important. We touched on that earlier. Shoes should be of comfortable, well-fitting, and provide what? Good support. The toe box of the shoe should be wide and not tight. Fourthly, regular checkups with a healthcare professional are essential. When you go to your doctor, you can speak to them. They can help spot any problems early and provide appropriate treatment, even if you can't see it. That's what they are designed to look for. Summary. In conclusion, promoting foot health in juvenile diabetes requires a comprehensive approach that includes education, good hygiene, appropriate footwear, regular checkups, and good blood sugar control. It's a team effort and everyone has a role to play. We move on to the power of community. In the face of adversity, heroes stand tall, reminding us of the strength and resilience of the Nigerian people. They embody the principles that make our nation great, which is courage, compassion, and a commitment to serving others. So let's take a moment to honor these heroes among us. They may not seek recognition, but they deserve our gratitude. After all, it's these everyday heroes who truly make it morning in Nigeria. And remember, we all have the potential to be heroes. As I've always said, we can't help everyone, but everyone can help someone. So let's strive to be heroes in our own ways, making our corner of the world a little brighter, a little better. That's the Nigerian way. So I want to make this quote very much. Diabetes is a part of my life, but it doesn't define me. It's just something that you have to manage, but you can excel in anything that you want to be able to do, as long as you put your mind to it. You just have to make some small adjustments in how you go about in terms of your daily routine. You can still be the doctor, you can still be a lawyer, you can still be an astrophysicist, whatever it is that you want to be able to do. Now we're looking for a plan for diabetes care. Again, I just want to touch on some of them: education, promotion, role modeling, and strategy. As someone living with diabetes, always strive to educate and foster learning. Role modeling. As someone living with diabetes, you are a role model. There's some children that are living with type 1 that actually they feel hopeless. They don't know how it is. So if you can be a helping hand to someone, you can provide that role model structure, because nutrition and exercise. Areas of focus: prevention. Prevention of the long-term side effects of diabetes, which unfortunately in my line of work I see very often. We see people that have kidney disease. We see people that have diabetic neuropathy. Sometimes we see with the amputation, which is the one that we're trying to avoid. We also look at community health, health promotion, and community mobilization. It's very important that communities get involved in terms of helping type 1 diabetes, type 2 diabetes, gestational diabetes, in terms of merging in terms of the society. So we would like to advocate for primary healthcare centers to do a lot more screening in terms of managing and promoting reduction of drugs, advocacy in terms of their lawmakers to give diabetics a chance of living more productive lives with the disease. In conclusion, in this presentation, I recognize the immense burden of type 1 or juvenile diabetes on our young ones and the community. I salute you and the heroes among us. I attempted to inspire, educate, empower, and ignite to action. I thank you so much. My name is Bilkisu Nauzo. Again, I'm the ED for Podiatry Foundation of Nigeria. Thank you. Dr. Morris.
Thank you very much indeed, Bilkisu. It's been a very useful lecture. So I'll ask our audience to make their comments and also to ask their questions.
Please, comment.
Okay.
I mean, I wanted to ask questions. Don't you feel some sensation on your feet or something like that?
Pardon?
Good afternoon.
Good afternoon.
Good afternoon. This is my name is Olayemi, and I've been living with type 1 diabetes for over 8 years now.
Okay.
This is actually my first time in hearing about podiatry, and
right.
I've saved some pictures from the slide, but I think I need more comprehensive explanation from you, please.
Okay.
Yeah. So everything you said was just something like you read from us, and I think I would like you to just like explain in a more comprehensive way and can break it down for me, because I'm actually very interested in this feet. Taking care of the feet is actually very important, because during my first 2 years I've actually had signs of, they were not cuts actually, they were just boils that just appeared from nowhere on my feet.
Right, blisters.
Yes, like blisters, and they were not from any cuts or anything. They were just, and I still have the scars on my legs. So I would like you to explain in a clearer way for me, please.
Okay. Well, thank you. In terms of getting blisters on your feet, do you play a lot of sports? Soccer, football?
Yes, actually, yeah.
Okay. So actually, because you're an athlete, because I would define you as such now, you have to be extremely careful as a diabetic when you play your soccer. I mentioned earlier in terms of making sure you wear adequate socks, and your soccer boots or football boots should be actually wide in toe box. Soccer is one in which there is a lot of contacts, basically. There's a lot of contact to the soccer. So you have to make sure that as you take off the boots, make sure that there's no rubbing against from the boots that you're wearing. If you see any signs of blisters, you can actually watch it, or you can go directly to your healthcare professional. You can make sure there's no opening in the skin. You dry it. You can put ointment if you have, but make sure that it's always dry, and make sure that you rest it, that it doesn't open up at any period of time, because of the opening that we don't want. And as you said, you have scars based on that.
Okay.
Did I answer your question?
Yes. You said washing the feet with warm water. Is it advisable to put antiseptics into the warm water also?
Yes, you can put antiseptic as long as it's not harsh. You know, you can have like a warm soapy kind of water, but make sure, because antiseptic, it dries the skin. You're talking about like Dettol, right? Sometimes it leaves very, very dry. That's why we said to make sure that it's moisturized. You moisturize it from the top, you moisturize it from the bottom. Do not put it in between your toes. And you pat it dry. So yes, you can put antiseptic, because antiseptic will actually kill the bacteria, but you don't want it to over dry the skin also at the same time.
Well, I've been advised not to put antiseptics inside warm water because it can lead to, like you said, dry skin and breaking down of the skin, and
Right,
it can actually cause
right,
sores in the feet too. That's actually asked the
right.
question.
As I said to you, it depends on when you have diabetes, you have to look at your own particular skin type, what works for you. That's why I mentioned just like a soapy kind of water, warm water, and then you use it, you pat it dry, do not rub your skin aggressively.
All right. Okay. Thank you very much for your answer.
Okay, thank you. Okay.
Please absent again. What's your? Hello, sis.
Hello. I recognize this person. Chima, how are you?
I am fine. So I
Yes.
have on the filament here to explain what you mean about sensation. So maybe they will do that for them.
Right.
And I also have my
Okay.
sneakers here. My sneakers, I can do that demonstration as you are explaining,
Right.
so that they
Right.
can get exactly what you mean. Is that
Right.
okay?
Yes,
So-
that's great.
So that's the
Thank
practical
you.
thing for you. Yeah. She's wearing the right. What you mean? So most of them wear this. This is very good for them,
Okay,
right?
Crocs. Yeah, these are
Yes.
Crocs. Actually, we will look for one that is completely covered, like a sneaker. This one, anything can actually go through it, through the back. It can cut the heel. You know, we're looking for something that has, like a sneaker, like has that complete covering.
She's wearing the comfortable shoes for her. For me, that's tricky as a lady who is going out. This is okay.
Actually, I would prefer shoes to be covered.
Okay.
You know, because don't forget now, anything can injure this, like this is open, right? So what we're looking for is for your shoes to be covered as a diabetic,
No, you know she's a
as a
young girl.
diabetic person.
They have lovely nails. They want their nails to be
I
seen.
know, but even with the nails and all of those things, they have to actually, I think I discussed with the nails, you have to actually keep the nails trimmed. I know they're looking for fashion and all of these things because they're young, but you know, they don't want infection. And
Okay,
which
see
is
my,
what we are concerned about.
see my sneakers. Yeah, that's the
Yes,
sneakers.
this is excellent.
Okay.
This
And
is
I'm
what we're looking for. We're looking for toe box, shoes, sneakers, or anything that has comfort. Usually wearing with socks to prevent rubbing. So sneakers, I like sneakers because why? They're encased. If you wear open shoes like Crocs or the slippers, the slide-on slippers, you can cut your heel. You can cut in between your toes. You can cut anywhere. And as a diabetic person, you normally will start losing that sensation.
as a person living with diabetes, please correct it.
Yes, as a person living with diabetes, please and please and please, please and please, it's very, very important that you keep covered shoes. I can't stress it enough because someone will start with a small injury that will turn into a deep ulcer. Maybe next year, if I'm invited, I will definitely come in with more slides and actual physical representations for you. Hello.